Mr. Vice President, whenever you're ready.
Shall we stand for our pledge of allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Well, good evening, everyone, and welcome to our Metropolitan School District Pike Township regular business meeting. And we're up first of all for the good of the cause. Does anyone that have anything that they'd like to share for the good of the cause, you can step to the podium, state your name, in 3 minutes. If there's anyone that has anything for the good of the cause. Thank you. No one for the good of the cause. Then we move on to Spotlight on Pike. Sarah Dorsey.
Good evening. It's wonderful to see you all again. We have had an amazing start to the 2024-2025 school year. We learned that Grace Miranda, who's our English Language Learners Department Chair at Pike High School, was selected as an Indiana Teacher of the Year Top 10 finalist. In a press release, Dr. Jenner said, "We have over 65,000 teachers in Indiana who work day in and day out to teach and support our students. So to be named a top 10 teacher is really a remarkable feat, and we could not agree more. And we're so excited for Mrs. Miranda and so grateful for the wonderful work she does with our students. And we also want to congratulate Jaslyn Miller, Jayla Miller, and Sanaya Smith for making the Major Moves Media National Girls Grassroots Review Class of 2027 Indiana Who's Who Top Girls Prospects for basketball. And last but not least, we want to thank everyone who generously donated to support our educators and students via Donors Choose projects like the ones listed on this evening's agenda."
Thank you, Ms. Dorsey. I'm sorry, I failed to omit our board president, Mr. Anderson, is out tonight due to an accident, so want to make you conscious and aware of that. All right, we're on to reports to the board. Marathon Health, Dr. Keisha Burley.
All right. Board Vice President, board members,
Good evening.
Dr. Young, thank you for your time today. My name is Keisha Burland, and I am with Marathon Health. I've worked in corporate wellness for 20 years, been with the organization for 8 years. My true passion is the health and well-being of individuals and seeing them achieve that health and well-being. So I'm here today with my colleague, Dr. Sumner, and we're going to introduce to you today a little bit of information about Marathon Health, and we're excited to have this conversation with you because we truly get excited about not only seeing individuals being able to achieve positive health and well-being, but also their employers who make the investment and give them the permission and the tools to be able to do so. So I'll let Dr. Sumner introduce himself.
Good evening, everyone.
Good evening.
It's a very familiar setting. My name is Doug Sumner, and I'm fortunate to serve as the Vice President of Education Affairs at Marathon Health, a role that I cherish. But previous to joining Marathon Health about 3.5 years ago, I spent my entire professional career in service to public education. Teacher, principal, about 12 years as an Associate Superintendent of Human Resources, and also served as a school superintendent. And I tell people without hesitation, in 30 years of service to public education, the best thing that we ever did for our staff was open our first on-site health center to serve our educators and support staff. By far, continues to have an amazing impact across our district. It's important to us tonight that we start our remarks with you, emphasizing what we believe as board members is most important to you, most important to the staff you lead, and most important to the community stakeholders that are with us this evening. And that's your mission, of course. A mission that doesn't take much to look around today and realize that it's a mission that's never been more important to achieve. And sadly, a mission that perhaps has never been more difficult to achieve. So often when we talk about investments for school district success, for student success, we're talking in terms of new facilities, we talk about state-of-the-art technology, we talk about a broad-based curriculum program, and please don't get me wrong, these are all very important things, all of which have a significant impact on student learning and your challenge to meet your school district mission. But I think everybody in this room would quickly agree that the one resource best positioned to help you achieve your mission are your human resources, your people. At the end of the day, everything we are as a school district and everything we achieve comes down to the performance of our people and their service to students and to the communities that we represent. Unfortunately, as you can see from this slide, our staff members, our educators are suffering at unprecedented levels. Recent Gallup poll indicates that K-12 public school educators are suffering burnout at a level higher than any other employee group in any industry across our country. So the one resource you have that can best position you for success is struggling at unprecedented levels. So what we would say to you is it's time to reinvest in our people. If we want schools to succeed, and we need schools to succeed, if we want students to succeed, and I know that's your priority as a board, our staff has to succeed first. Because this is what we know about burnout. Burnout is not having a rough day. Burnout is not having a tough week. And burnout will not be overcome or managed by getting a little extra rest over a long weekend. What medical professionals tell us is that burnout is directly connected to an individual's physical and emotional health. And right now we have teachers and support staff members in your hallways and in your schools doing the very best they can under increasingly difficult circumstances and with decreasing levels of health. So for decades, school districts have done the best they could in offering fantastic access to health care, health insurance, which in our opinion basically provides a pathway to care. When you provide health insurance, you're saying to someone, hey, listen, if you need to seek care for physical health or emotional health needs, here's a pathway by which you can achieve that. And yet we know, due to limitations and obstacles with time, with cost, and candidly with a patient experience that is increasingly more about efficiency than it is effectiveness, many educators, many of whom you employ every day and work with your kids every day, many educators are failing to seek and receive the care they need because they don't have the time or the mindset or the opportunity to do it. So we believe it's time to quit offering a pathway to care and begin offering the care itself. And again, this is in conjunction with the idea that as a board, we believe that the most important thing you can do for kids every day is surround them with happy, healthy, high-performing staff members, and we believe we can help you do that.
All right, so Dr. Sumner explained kind of the reason behind the conversation. I like to start with the problem. So insurance, as he mentioned, is a pathway to health care. As you may or may not have experienced in traditional healthcare, there are some challenges with it. The problem is, and how it's broken, is how it's designed and how it's set up for us as consumers. The intent of primary care is to be a funnel. The funnel is so that you can receive great care at the top of the funnel, and then it becomes smaller so you have to receive less care that is more costly or at later stages in a disease state. Unfortunately, because we don't invest enough money in primary care, that is not a funnel. It's become more of a filter. Because we're not spending the money that we need to on primary care and putting the emphasis on primary care that we should, primary care providers are referring their patients to specialists because they don't have the time to spend with the patients to talk to them about things like healthy behaviors or how to prevent chronic conditions from happening. They are referring them out. Primary care providers, they're paid on volume in traditional healthcare system. The more patients they see, the more money they get, and primary care providers are the least paid doctors out there. Okay, so they're not getting incentivized to take the time with their patients. So on the flip of that, Marathon Health, we kind of focus on health outcomes instead of volume. So all of our providers, they are salaried. They're not paid based on the number of patients that they see. Instead, they are their performance is based on the outcomes of the patients that they see. Are they getting healthier? Is their blood pressure coming down? Is their blood sugar improving? And with that model, those individuals, there's a reduction in the specialty visits that are needed, which are extremely costly, as I mentioned. And so it helps save the health plan that you're offering your staff. And so this is kind of mutually beneficial. It's a really great experience for patients. And then on the other side of that, the district, the employer, saves money as well. So the problem isn't necessarily the providers, okay? We educate, we train very highly talented and passionate providers. Again, the problem really lies in how the system is designed to allow them to do the job that they entered into and that they wanted to do. We find that providers come to Marathon Health because they're so disgruntled that it's kind of, like they're just pushing patients in and out. And, they're not finding satisfaction in their job in doing that. Our patients spend an average of 30 minutes with a provider who they get to know as a person. They get to know about their family. They get to know about the work environment that they're in. What is causing them stress? How can we address that? Versus, I don't have time to talk about those things, so I'm going to put you on blood pressure medicine. Okay? So that is the joy that our providers have with this model. And then because of that, the patients have a better experience where we see great engagement, repeat engagement. I don't know how many people here see their primary care provider 3 times a year, but on average, that's what our patients do because we see them on a frequent basis. It's high touch. As a result of that, we see their health improving. We have amazing outcomes in the patients we see, and then ultimately, as a result of that, we see cost savings. So fewer ER visits. And overall savings for those that are engaged with Marathon on the health plan, it's saving about $1,800 per member per year.
So to make this as simple as possible, Marathon Health endeavors to achieve 2 outcomes on behalf of the school district. Number 1, and perhaps most importantly, is improve the health of the staff members that you employ, so they're better prepared to complete the service to students that is required of them or expected of them every day. The second outcome, of course, is to save money. And there's kind of a backwards by design formula on how we can achieve that when the community medical health system is failing to do so right now. Number 1, we improve access. We improve physical access so that they have greater access to locations where they can seek primary care. We improve the hours of operation that they can seek access. Right now, one of the problems if you're an educator to getting to the doctor is that you're at work by 7 a.m. and you're still at work at 4:30 p.m. So when do you go to the doctor? Typically you don't. What you do is you wait until you're feeling so poorly that you go to an urgent care center. And then all we're doing is we're treating today's illness. We're not focusing on health. We're focusing on treating illness. Our vision is to establish and maintain health and get out of the business of simply treating illness over and over again. And again, step 1 is to improve access. And we're going to do that physically, and we're going to do that by the opportunity to see a provider at times that are convenient for your staff. We're also going to improve access to a scope of services that is comprehensive in nature. The next thing we're going to do is we're going to fundamentally change the patient experience. We're going to make sure that the minute you walk in the door to seek care, that you are treated like the service provider you are. No one knows service to others better than educators do because they do it every day. So you're going to have a truly different, more appreciative patient experience the minute you walk into our health center doors. And then finally, what we're going to do is we're going to work with the district to make sure we are engaging your members in their healthcare journey. None of this works if people choose not to go to the doctor. So we need to work with you strategically to make sure we have plans in place to promote these services so people access them. And it generally does start by treating an illness. People use this out of necessity first, and then they become conditioned to the experience, and now they start to focus on health. And the healthier people are, the better they perform. So this is a slide that I love because it shows not only are we working well with our existing education partners, but we are succeeding with them. We are engaging people at high levels, we are improving the health of those we serve, and we are saving districts substantial amounts of money on their annual claims spend. And amazingly, we're doing all of this under the umbrella of a 98% patient satisfaction rate, which is amazing. The other thing on this slide that I'd like to point out is that for 6 consecutive years, we have won Best in Class, which identifies Marathon Health as the highest performing employer-sponsored healthcare organization available. And we have scored our highest marks in the area of loyalty, product value, and relationships. And we think it's those 3 things: our loyalty to our clients, the value of our product, and the relationships we build with our partners that have allowed us to earn a 97% client retention rate. So I'm going to pass it back to Keisha.
Okay, so let's get to MSD of Pike Township. So in conversations that I have had the privilege of having with Superintendent Young, he has shared with me some goals of the district, which I think covers some of the things that we've discussed. The district has done a phenomenal job of controlling your healthcare costs, noticing that there was no increase in medical spend this last plan year. And where we want to come in and support you is ensuring that those healthcare costs remain low and control those costs, because as we know, the national average, we're seeing anywhere from an 8 to 10% increase in medical costs year over year. So how can we come alongside you and help to continue to control those costs and even lower those costs where possible? In addition, and more importantly than really controlling cost, is really has to do with providing access to holistic care. I have been able to learn and understand the importance of the district and putting your staff members' well-being first. And I know that that is a very strong mission that you hold. And I feel like this adds another layer to that. In addition to that, this also can help the district attract and retain top talent. You probably saw on the previous slide some school districts that we work with throughout the state of Indiana. And we understand the challenges of attracting top talent, and this is a very valued benefit we found for employees. So for MSD of Pike Township, we took a look at your staff members and where they live in comparison to the 7 Marathon Health locations throughout the Indianapolis metropolitan area. So these 7 locations you can see on the slide as the purple dots, and then the colored regions are where the volume of where your staff members live. So this exercise showed us that 93% of your employees live less than 10 miles away from one of those 7 health centers. As Dr. Sumner mentioned, we have a lot of client partners that have on-site health centers. Some of the limitations of that is that you're limiting the access by just having it at one single location, and that can be a little challenging, especially for spouses and dependents as well if they live farther outside of the district. So this model allows you the maximum amount of access, extended hours from 7 a.m. to 7 p.m. Monday through Friday, and Saturdays from 8 to noon. We do have a Traders Point location at 86 and Zionsville Road that is right in your district area. The services that we offer, as Dr. Sumner mentioned, we have a very holistic, inclusive service offering that is included in your investment. So patients can see us for primary and preventive care. We do not have to be the primary care provider for your staff members. We are an option for them. They can continue working with other doctors that they have, and we will work collaboratively with that care team if they have one established. We can also see patients for urgent care. So if they are not feeling well, they can come to see us for 6 reasons. Condition management. So if a member does need support with diabetes management, blood pressure management, those are areas that we can help with. Mental health services, we have 6 behavioral health counselors in those 7 health centers who work 40 hours a week, so behavioral health services are available. Members can also receive on-site labs at one of our health centers. Those labs can also be ordered by an outside provider, so we're just adding some convenience for them to get labs drawn, and there's no cost to them for having them drawn there. Immunizations and testing as well. general wellness and health coaching, so we can work with patients on behavior change if they're working on health-related goals. Value-driven referrals. This is an amazing service where if a patient does happen to need to be seen by a specialist, we have a team of referral coordinators that will handhold them through that process, and they have technology and a tool to identify specialists that are low cost, high quality in their area. So I know a lot of times we are handed a piece of paper if you're told, it's time for you to get a colonoscopy, here are some options for you to go see, and we're responsible for choosing and scheduling and doing all of that, and 60 to 70% of the time the patients don't follow through with that. Our referral coordinators will inform you of the best options that are in your area. They will also go as far as scheduling that appointment for you, so it's a very hands-off process. And then I wanted to get to the ROI, so your investment dollars. Your investment dollars in looking at your claims data and how we feel we can impact your population. That 1.7 to 1 ROI means that for every dollar the district spends on services, on our services, you would get a return of 1.7 on that dollar, or $1.70. Over the course of 5 years, that would be an estimate of $2.4 million. You can see in the graph the bar, the light green bar on the left. That is the estimated costs without a health center, without a Marathon Health. And then we're looking at the national average increase year over year in that left-hand green. On the right hand, that would be your healthcare costs with Marathon Health in place and how we can help contain that. And then the purple is your investment in Marathon Health. So the dark green plus the purple, we still see that being below the projected healthcare costs over time. And then let's go to the next one, yep. And then the areas that we can save in, I've already talked a lot about these, but just in general, when patients see us, because of the way we provide care, their overall health improves. We prevent asthma attacks because we're better managing asthma. We're better controlling blood pressure. So in general, those individuals who engage with us, looking comparatively to those who do not engage with Marathon Health, as I mentioned, they're about $1,800 per year less. We help redirect care. So if they, in Doug's example earlier, if someone was tempted to go to an urgent care center because they waited too long, they now have the option to go to Marathon Health because we do have same day and next day appointments available. Very easy to access and get into. And then through our lab and RX, our costs tend to be cheaper than what the plan would pay for those, so there's cost savings experience there as well.
So we've thrown a lot at you this evening, and we hope that it's resonating with your mission and the purpose that you have every day for students and how staff are your best vehicle to achieve those outcomes. Educators are a special group of service-focused individuals, and they provide that service in an environment most people will never understand. I think sometimes as people who have been students themselves or parents of current students, we think sometimes that we understand what's happening in the halls and the classrooms of our schools. And I've always told people that to truly understand the charge of being an educator or a support staff member in an education setting, it's probably best that you've experienced it firsthand to truly understand. And so we know offering a service like this, something that is as personal as healthcare, requires connections. Just like the personal relationship that has to exist between a teacher and a student to get the best out of that student. We know that we have to connect to understand your priorities, your needs, the vulnerabilities of your staff members, their schedules, how we can serve them best. And as we looked at our area teammates, we were thrilled to see that those connections are already occurring, that we have many staff members at Marathon Health that have direct ties to Pike Township. And we think this will be the opening for us to establish a partnership that allows us to serve your staff as well as they are serving your students. And we thank you for your time, and of course, we'd be happy to answer any questions you might have this evening.
Any questions from the board at this time? Thank you. Any questions from the board at this time?
The network of doctors, your network, explain how your network works with Marathon as it relates to the staff here at Pike Township? How will they be able to access the network of doctors? I think you did mention that you do have somewhat of a network, but you also have a way of being inclusive of other networks.
Absolutely. So this service lies outside of your health insurance. So our providers that are providing care within those 7 health centers that we showed on the map, they are Marathon Health employees, salaried employees, so they would be able to seek care with any of those providers at any of those 7 locations. And network can be confusing because a lot of times we think in-network with insurance, right? Completely separate from that, and it's probably poorly named on our part. So that network is not part of the insurance. We just define that as the 7 locations through Marathon Health. So any care received from through Marathon Health does not have any impact on your health insurance. There are no claims submitted. So patients can still see providers that are in network through your health insurance for other reasons or with other providers that they currently work with. That would be continue to run through your insurance.
Your theme tonight was staff and cost. When we look at the cost, we're looking at $48,000 a year for the next 5 years in savings. Do you see that being increased?
Absolutely.
Okay.
So sorry.
No, I was simply going to say, based on our current book of business with education partners, that is a very conservative estimate. And what we do see is a trend for that savings to increase as engagement increases. The more people learn about the health centers, the more they start to use them, the more they start keeping those claims off of your insurance costs, the more they start to take preventative medicine as a focus, right? And not treat illness, but stay well. The more those claims go down, the more you save, and that's been the trend we've seen across our book of business.
I was going to echo that. Your savings is directly correlated to engagement. The more we engage folks, the more savings you will have in your claims environment.
Less engagement, the less savings.
Yes, sir.
Exactly.
And everybody in this room knows, everybody in this room knows that people don't wake up in the morning excited to go see a provider for their medical needs, right? So what we're going to do, again, is we're going to focus on removing the obstacles that make it a second thought and even shifting the mindset that people have. A lot of people don't go for the reasons I mentioned earlier. I don't have the time to go. A lot of people don't go because of the cost. If I'm a custodian and I have to pay a $70 copay to go to the doctor, that's more than half a day's pay. I'm probably not going. I'm going to tough it out and hope I don't get even more ill. So we're going to eliminate those barriers. But we're also going to work on probably the most difficult barrier, which is mindset. I haven't been to the doctor in 7 years. I don't want to go because I don't want bad news. So we have to start to promote these services in a way that resonate with your staff to motivate people to re-engage the health process within themselves. And we've been successful in doing that across the board.
Lab work is going up. I'm pretty sure you're very much aware of that. Then secondly, we have a serious issue in this country with prescription issues.
Right.
How are you going to bring benefits to the staff as it relates to prescriptions?
Absolutely. Do you mind if I address the labs first?
Yeah.
So for labs, we directly contract with LabCorp. So we have negotiated rates with them that are 60 to 70% less than what it would cost to have the same lab done at the traditional hospital system or primary care provider. So for example, our A1C lab to test for diabetes, that's only $2.50. A lot of times the hospital systems will charge you additional fees on top of that, such as a administrative fee, a stick fee, and pay for the Band-Aids and all those other things that we do not charge for. Secondarily, to your other question with medications, that's kind of twofold. We have about 140 medications on our formulary, only generic for the most common needs, and chronic medications, as well as acute needs if you're sick, your antibiotics and things like that. Our direct costs with our medication provider is also negotiated, so those fees are usually a little bit less as well. But how we really save is, as I was speaking before, the providers get to spend more time with patients, so they're not so quick to prescribe a medication. They work on other things first, like behavior, if it makes sense. And let's see how we can do with this first before jumping to medication.
Did you suggest that generic is secondary or firstary in this particular situation?
Generic is all we offer.
Generic is all you offer.
All we offer, yes.
Thank you very much.
You're welcome.
I have a question. I'm wondering, with the visits for staff, are they primarily visiting with nurse practitioners or physicians?
Both. We have nurse practitioners and physicians in our 7 health centers. When they schedule, we have an online scheduling tool and an app. So they have the ability to select what provider they would like to see, and it clearly lists their credentials, if they're a medical doctor, if they're a nurse practitioner, or if they're a physician's assistant.
And then my next question deals with your partnership with us. You mentioned several times throughout your presentation about holistic medical care coming alongside us. We already have a wellness committee here,
Yeah.
and I'm wondering, how would you come alongside us
Yeah.
with our committee in helping us reach our goals?
We love wellness committees. So,
And especially the gentleman you have leading yours. Yeah.
yeah, so you would have an account manager that you meet with on a regular basis, usually monthly, at the very least quarterly. We have a lot of reporting and data looking at the engagement of your population, the health risks of your population based on their, as they engage with us, and we're capturing that information. So we use the data and the reporting that we share with you in those meetings to then begin to strategize. If we notice that engagement is not where we'd like to be, then we set different action items to grow engagement. If we're seeing your population having high blood pressure, we talk because you know your people better than we do. So we that's why we like working with the wellness committee, because they can tell us these are the things that work well for us. Maybe it's not emails, it's home mailers, or whatever the case may be. So we work collaboratively with you on helping to identify the areas of opportunity, and then you can help us collaborate on a possible solution.
My role is also directly involved in working with district representatives like wellness committee members. My sole role is to support the growth and the account management needs of our education clients. It's all I do. And so we will work with your wellness team, to learn how to best promote the health center, best engage, initial engagement strategies, things like that. We'd like to at some point be in front of your building principals, everybody, to start championing the message of taking care of yourself, and here's a way to help that happen. We can help position those conversations, be it in small building wellness committees or in principal meetings, so that they can then deliver information through their building staff meetings and things like that. So we will have folks in your district will have our mobile numbers to contact us whenever there's a need for us to do outreach. Simple things like a professional development day. Hey, we're going to have 5 schools in one building today for PD. What a great place for us to have a table set up for Marathon Health, handing out information or reminding people of our presence and our service and what we do, and trying to engage people in that process right away.
Thank you.
So what we would like to do, for time's sake also, is get you all back in a work session. And then the board, I'm sure we all have other questions, because we have some.
Yes.
Dr. Moore have one again. So we'd like to get with the superintendent and then get a work session scheduled and answer any questions that we may have.
We would love that.
Yeah, we will.
Thank you all.
Thank you for
Yes,
your
thank you for your time.
Thank you.
Dr. Wilson.
Yeah,
Thank you, Dr. Wilson. How long have you been in existence?
15 years.
15 years in the medical. Okay, thank you.
Yes. Yes.
thank you all.
Thank you.
Okay, we're on to action items tonight. First up is the approval of our last minutes of our Board of Education meeting.
I move we accept the minutes as presented.
Second.
It's moved and second that we accept our minutes from our last board meeting, July 25th, 2024. All in favor, say aye.
Aye.
Opposed. Next up is HR report, Dr. Justin Hunter, along with this supplemental personal report.
Mr. Vice President, members of the board, Dr. Young, I ask that you approve the HR report as presented and the supplemental personnel report as presented.
Motion is in order.
I move we accept action items B and C as presented.
Second.
It's moved and second that we accept action items B and C as presented due to the confidentiality of our reports. On items B and C, we move on to vote. All in favor say aye.
Aye.
Opposed? Thank you, Dr. Hunter. We're on to
Thank
action
you, sir.
item D. Dr. Alicia Gatewood.
Good evening, Mr. Vice President.
Good evening.
Members of the board, and Dr. Young. I am seeking approval of the books for the African American Studies class at Pike High School as presented.
Motion is in order.
I move we accept the books for African American Studies at Pike High School.
Second.
Been moved in second that we accept action item D as presented by Dr. Alicia Gatewood. Are there any questions on action item D? No questions, then we're on to vote. All in favor say aye.
Aye.
Opposed? Thank you, Dr. Gatewood.
Thank you.
We're on to action items E and F as presented by Mr. Gruber for recommendation of approval.
Good evening, Mr. Vice President, members of the board, Dr. Young. I'm requesting approval to seek bids for upcoming Blue Ribbon projects, which include the Deer Run interior refresh and 3 roofing projects, one at Snacks, Fishback, and sorry, let me get it right in front of me, Deer Run as well. I request your approval as presented.
I move we accept the, sorry.
E and
I
F.
move wow. I move that we accept the requests on item E and F as presented.
Second.
Been moved in second that we accept action items E and F as presented tonight by Mr. Gruber. Are there any questions on action items E or F? No questions, we're on to vote. All in favor say aye. Aye. Thank you, Mr. Gruber. And we're on to action items G, H, and I. Recommendation of approval. Mr. Foster.
Good evening, Mr. Vice
Good
President,
evening.
Mr. Members of the Board, Dr. Young. I present to you items G, H, and I. I recommend your approval as presented.
So moved.
Second.
Been moved in second that we accept action items G, H, and I as presented by Mr. Foster. We've had a chance to look at them. Are there any questions? All in favor say aye. Aye. Opposed? Thank you, Mr. Foster.
Thank you, Dr.
We're on the board member items. Dr. Moore.
I have nothing at this time, Mr. Vice President.
Thank you, sir. Ms. Lomax.
Good evening.
Good evening.
So glad that everybody is back. We're off to a great start. Go Pike. Hashtag Pike Proud. Go USA. I'm into the gold medal count. I'm all in the gold medal count. Staying up too late at night.
Lord.
Yes. And so go Pike, go USA, and go vote.
Thank you, Ms. Lomax. Ms. Barnes.
Thank you. Last week, it was my pleasure to attend the Meet the Teacher Night at Guyan Creek Elementary School. The school was full despite the heat. I literally had to park at the middle school, but it was okay. I got to see the Guyan Gators getting ready for a great year, led by Mrs. Rose and Mr. Kroon, who were fielding all kinds of questions at the door, in the hallways, and meeting the needs of our parents. This week, on Tuesday, I visited 4 Pike community neighborhoods for National Night Out, where I got to meet amazing members of our community. It's my honor to represent you as a school board member, and congratulations to Miss Miranda for making the top 10. That's kind of Olympic, I think, in a way. The top 10 Indiana Teacher of the Year. Pike, once again, is the gift you didn't know you needed.
Thank you, Mrs. Barnes. Dr. Howe.
Just building on what Mrs. Barnes said, next week is back to school Tuesday, Wednesday, Thursday at the high school, middle schools, and elementary schools. So I'll take the opportunity, check out the community partners that'll be there, and the extracurricular school activities that will be there. I know there's lots of studies out there that show students that are involved in other activities end up doing better in school overall. Thank you to our transportation team on a great first week. I know there's a lot of moving parts, a lot of changes happening, and lots of new kids, and just thank you for all that. Parent Square has been a phenomenal success. As a parent, I'm Happy to have everything in one place. I'm not looking at emails and texts and skylerts and everything, so thank you for that. And again, congratulations to Mrs. Miranda on her recognition as a top 10 teacher. It's phenomenal. Well deserved.
Ms. Kelly?
Welcome back. We are in the full swing of second week with students back in the building. Excited to see all the learning taking place already, all those that are getting acclimated, and those that are back in their safe places with their teachers. Not that homes aren't safe, but they're with teachers where they are still feeling safe, and teachers are encouraged to build those relationships with students to help them grow in the learning environment. And just excited to be here for this. Thank you for everyone that is welcoming our students back, has been getting ready, and now are doing what needs to be done for our kids to be successful for this school year.
Thank you, Ms. Kelly. Dr. Young?
Thank you, Dr. Webster. I'd like to echo what has been shared. Thank you to all of our educators, those that are home, but then also our leaders that are here this evening. Oftentimes I forget to recognize them, but they're behind the scenes making sure that things run really well even at the building levels, but have really enjoyed spending time in the buildings. Typically this time of the year I get 13,000 steps for the first 4 or 5 days just trying to get in all the buildings. My team was laughing at me because I've officially graduated to Dr. Scholl's full-time, so I would ask the board for a little bit of leniency on my more casual shoes. But I had a pain last year, and it had gone away, and I'd forgotten about it. Well, guess what? The first day of school, about midday, it hit me, and I realized it was my shoes. So I will be wearing more casual shoes for the remainder of my career. But it was a great start. Dr. Bishop, Mr. Jacob, and others had the opportunity, along with myself, to be at IU Indy. Today we'll be back down there all day tomorrow. And we were in a training over monitoring the progress of district-wide equity efforts with the Midwest Equity Center. So it was a great training today. Look forward to getting back there tomorrow to wrap that up. So with that, thank you.
Thank you, and that will do it for tonight. I offer motion to adjourn.
So move, Mr. President.
Second.
Meeting adjourned.